In this video I want to share with you how I use this head-mounted laser to help assess your upper neck to see if we can get to the cause of your headaches. And actually we can also use this laser to help as a form of treatment to help get your neck working better as well. Now the reason this is important is a lot of headaches, in particular things like those tension type headaches, cervicogenic headaches, often have a link with some sort of neck dysfunction. And if we have a headache, it's quite easy to jump straight to the medication and get some of that symptomatic relief. But if we don't actually try and understand what's causing those headaches, then it's just going to keep on coming back all the time and we're going to be going around in circles. So using things like this along with a few other techniques are a great way of trying to get to the cause of your headaches, so that once we deal with that, hopefully those headaches won't keep on coming back all the time. Hi, I'm Craig from Elevate Chiropractic, and I've been helping people feel, move and function better for the last 14 years. When someone comes to see me in practice, there's a range of different things we do to assess how their neck is working. This is like range of motion testing, so can you twist your head to the same both sides, can you tilt it, these types of things. We use our hands to palpate and assess those joints to see if there's an area that's not moving as well as it should do that we can potentially start to work on. Is there muscle spasm that could be potentially referring pain up into the head? All of these types of things give us an idea of what is working and what's not working. This laser pointer is again just another tool that I use, and what I'm looking for when I use this is what we call proprioception, or our joint position sense. Now proprioception is often referred to as our sixth sense. So for example, if I place my hand behind my back but wasn't touching anything, now I can't see it or smell it or taste it or feel it, but I know exactly where it is. That's that awareness of our body and where we are in space. And it makes sense that in order for our brain to control our body well, it needs to know exactly where all of our bits and pieces are. And the more accurate that is, the better the control, the better our body will be feeling and working. So when I use this, I'm doing a little test where we stand in front of the wall. There's a mark that we use that you can then put the laser on. We'll get the person to close their eyes, turn their head all the way to the side, come back to the middle and open their eyes. Now, in an ideal world would be 100% accurate with this and would get straight back onto that same spot. But that very rarely occurs, if ever. But what I'm looking for is there a big difference from side to side, or are you way out? This gives us what we call a joint position error, or how much of a deficit is there between where we think we are and where we actually are. And this is sounds weird, but it's actually sometimes quite funny when someone's way off and they open their eyes and think, whoa, that is such a big difference. What's going on there? And that's part of that joint dysfunction that can affect how our brain controls our body. And of course, from there, what we'll do is then start to correct that joint, improve the motion, and that accuracy will start to come back. And in fact, we can actually use this laser to help improve that process as well as a bit of an exercise as well if we wanted to. One of the things that I have used is there's a poster with a maze on it, and we can stand there and take the laser through the maze. It's just making those muscles work to help improve that communication between your upper neck and your brain. Now all this sounds a little bit weird, but it really does give us a good picture into how your spine and in particular your upper neck is working. Now if you are suffering from headaches, please make sure you go back and watch the previous videos I've made over the last couple of months, showing you some useful hints and tips that you can do to hopefully get on top of those headaches and get things at least feeling a little bit better. If you've tried all those and you're still suffering, then please give me a call on 413-5312 and I can answer any questions that you may have, and we can even find a time for you to come in and we can do all of our assessments, including this laser, to see how well your upper neck and in fact the rest of your spine is working. So hopefully we can start to make some positive changes and you can get on top of those headaches. Of course, if you have any other questions, comment down below. I'll do my best to answer those for you as well. But until next time, take care. I'll see you soon.